My name is Dr. Megan Doherty, and I'd like to share with you some thoughts on palliative care education in humanitarian settings. My objectives are that after this presentation, you will be able to describe the importance of palliative care education in humanitarian settings, discuss current educational opportunities available for palliative care learning for humanitarian healthcare workers, and know how you could become involved in educational initiatives in this setting. If we reflect on the WHO foundational measures for implementing palliative care, we can see that education is a key pillar. This includes education of healthcare professionals as well as the general public, and healthcare policymakers, administrators, and drug regulators. If we focus in on education for healthcare professionals, we know that we want to develop a skilled and capable workforce. Palliative care education is about developing and supporting healthcare providers. We know that particularly in low and middle income countries, teaching on palliative care and pain management, particularly the use of opioids, is not systematically incorporated into undergraduate medical training programs. This means that myths about morphine and the risks of addiction are common among physicians and other healthcare providers, and these prevent patients from accessing essential pain treatments. A lack of palliative care education has been identified as a significant barrier to improving palliative care availability in humanitarian settings. Often we may think of palliative care as just the very top of this pyramid, the care provided by palliative care specialists. But there's also a palliative care approach and general palliative care. And since most healthcare workers in humanitarian settings are providing generalist level medical care, we can target general palliative care as part of what they can provide. In this case, staff have additional training on how to listen well to patients, communicate effectively with them, and how to treat common symptoms such as pain. Staff also receive support and training to learn how to focus on the patient and family's needs holistically. In the palliative care approach, we can use trained volunteers and healthcare workers, such as community health workers, to focus on quality of life and provide child and family-centered care. Often this occurs for families living in their own homes. And really this comes to a question of how can we use education to support collaboration and knowledge translation? So recognizing this need to enable knowledge translation from those with palliative care knowledge and skills, we formed a dedicated palliative care team with experts and supporters from Bangladesh, Canada, and the US who work together to deliver and develop a virtual learning program to build palliative care capacity among healthcare providers responding to the Rohingya refugee crisis in Bangladesh. This program was a collaboration between Palchase, the Fasiuddin Khan Research Foundation, a Bangladeshi organization providing palliative care in resource-limited settings, and Two Worlds Cancer Collaboration, a Canadian NGO. We chose virtual learning as it can be particularly beneficial in resource-limited settings. It reduces the need for healthcare professionals to travel to attend training and to miss work while they're attending the training. The program we developed consists of a structured course with 11 weekly sessions on key topics in palliative care. After participants complete the course, they're then encouraged to continue learning through attending monthly mentoring sessions, which are provided on various topics which they indicate they're interested in. Virtual learning does have some challenges. Particularly, participants note that the lack of face-to-face interaction makes learning challenging. It can be challenging to ensure that there's active participation from learners, which we know is important for deeper learning and practice change. Additionally, the faculty needs to ensure that the content is relevant to the local audience and their healthcare situation. Participants note that it's frustrating to have teaching that's focused on medications or treatments which are unavailable or unaffordable in their setting or region, or training that does not reflect the cultural realities of their work, and this is particularly relevant in palliative care. Recruiting and retaining participants can also be quite a high challenge. We know that there's a high rate of staff turnover in humanitarian settings, so many of the participants who join a course initially may not complete it. The timing of sessions is particularly important, and sometimes this is during work hours when participants can join with their team and there's good internet access at their place of work, and sometimes sessions are preferred to be after work hours when they can join once they're free and they've seen all their patients. Defining and recruiting target learners is important, and this can be challenging if you don't have an established network in the place where you want to do the training. We use personal and professional societies and networks to advertise and share the course information with potential participants, and this was done through the Fasuddin Khan Research Foundation as well as MSF and IOM for the courses in the Rohingya camps. Seeking input from participants when they start a course is also important. We designed a very brief mobile-friendly survey which asks participants about their learning needs, the topics they're interested in, and their preferred timing for sessions. And you can see here a screenshot of one of the questions that would pop up on their phone when they did the survey. Which topics would you like to see covered? We found that things that are mobile-friendly and can be shared via WhatsApp are much more likely to be filled and be accessed than email or things that require a full computer. Here's an image showing the palliative care ECHO faculty team. The team includes nurses and physicians who practice palliative care in Bangladesh, who speak the local language and are aware of the local situation, as well as international experts in a wide variety of palliative care disciplines, including nursing, pharmacy, social work, and medicine. Many of the physicians who are international who are in this group have also had experience being in the Rohingya camps or providing training in the region. The course includes a resource library through Google Drive where the participants can access presentations, free textbooks on palliative care, relevant guidelines, journal articles, and more. Additionally, we record all sessions and upload them to a private YouTube channel. This allows participants to watch any sessions they miss and share the recordings with their colleagues or use them for their own teaching in the future, and we encourage them to do these things. A sense of community and the opportunity for networking that are afforded by the ECHO program are really important to participants. Here's a few quotes from participants about how they feel being in the program. So I actually feel that I am in a community. I feel that we are sitting in one room. I do feel that. I think it is good that I feel that I'm in the community, in learning from different countries. When I saw the ECHO facilitator for the first time in Bangladesh, I didn't feel like I was a stranger or anything. We knew each other for 1 year on the ECHO platform, and it's kind of helped us to speak easier. Increasing knowledge and skill is noted in participants, and we do include surveys of participants' knowledge, attitudes, and skills before and after participating in the program, but I want to share this quote with you, which is particularly impactful. Before the ECHO session, I had a fear and a feeling that I could not communicate with children. By the ECHO session, now I know how to communicate with children, how to talk with their parents about death and the prognosis. This is the most important thing that I learned from ECHO. So overall, it seems that virtual learning opportunities such as Project ECHO present an emerging model of building palliative care capacity in humanitarian settings. We've run 4 iterations of this palliative care course that I've described, and more than 300 participants have attended at least one session, either a mentoring session or one of the course sessions. On average, we have 34 participants attend each session, and more than 100 have successfully completed the introductory course. I want to highlight just a few other palliative care training opportunities that are available that we've been involved with developing. There's an online self-directed course which has recently been developed by MSF and will be used in the future for training their staff. Thus far, there's one module on what is palliative care with a plan for additional modules to come. These are self-directed, meaning participants work on them at their own pace on their own computer. There are several other online learning platforms that we're exploring and hope to develop palliative care courses on. These include Kaya Connect and Disaster Ready. Both are free online learning platforms which provide training modules for humanitarian healthcare workers. We envision that a palliative care module could be added to these platforms, and then various humanitarian healthcare providing organizations may require this course for certain staff who are being deployed to their projects. Additionally, we are working with the ICPCN and have started to draft an e-learning module for their platform on pediatric palliative care in humanitarian settings. Lastly, I want to share with you about how you can get involved in educational activities in this area. You can join the PalChase Education Working Group by filling out the link below. We have monthly meetings and we work to collaborate on educational initiatives for humanitarian health workers. Additionally, the Education Working Group provides educators with supports if they're looking for resources or other supports to develop training materials. We have a How to Make a Palliative Care Echo guide and a resource library. We share presentations and videos and other resources with anyone who's interested and looking for these supports. I want to thank you for your kind attention today and hope that this presentation stimulates some interesting discussion during the workshop.